Good morning and happy Friday. Governor Kate Brown here to give an update on COVID-19. And I'm joined virtually by Pat Allen, Director of the Oregon Health Authority, Rachel Banks, Oregon Health Authority's Public Health Director, and Dr. Dean Seidlinger, our state epidemiologist. Since the start of this crisis, I have been absolutely committed to giving you a full picture of where Oregon stands with our pandemic response, even when it's hard news to hear. This week, our statewide 2-week freeze ended and our new risk and safety framework launched. The majority of the state has moved into the extreme risk level, which means the virus is still widespread across 25 counties. These counties remained under very strict restrictions. Times are really tough right now, not only in Oregon, but across the country. I've said this before, but it needs to be said again. We are not out of this crisis yet. I know it's hard to imagine, but in fact, our hardest days still lie ahead. Oregon hospitals are filling up and many are reducing elective surgeries. Today, unfortunately, we have a record number of infections again, more than 2,100 cases, and sadly, 30 deaths. The fourth straight day of double-digit deaths in Oregon from this virus. And we are all so ready for this to be over. Our new modeling confirms our worst fears that this pandemic can indeed get much worse before we get the majority of our population vaccinated, and it likely will. I will let Director Banks share more, but what we know is that it's certainly possible that by Christmas, we will be reporting more than double the case rates we are seeing now. And when I think about that, I am just horrified. I know a large majority of Oregonians recognize how serious the situation is and that we are on the brink of a full-blown crisis. The data proves this. More than 84% of Oregonians are wearing a mask. Recent data shows that transportation across the state is down by 35%. Cell phone mobility data also tells us less people are going to the office and more Oregonians are staying home, which means many of you are taking the right steps to stop the spread of this disease. 10 months into this pandemic, when we are all so incredibly tired of dealing with COVID-19, the data is showing that the majority of Oregonians are listening. To every one of you who continues to make smart choices and follow our public health recommendations that help stop the disease from spreading further, thank you. Thank you. To every one of you that is staying home to the best extent possible and wearing your mask, you are helping protect our doctors, nurses, grocery store employees, postal workers, agricultural workers, and the many others who we count on to keep society going during the pandemic. Thank you. Thank you. I know it's exhausting and the sacrifices are real, whether it's closing the indoor dining to your favorite restaurant or balancing work from home while helping your children with distance learning. Or maybe you just miss your friends and families this holiday season, but limiting your social gatherings because you know that's the safest way to protect them and others. Thank you. Your actions, as hard as they may be, are truly making a difference and they are saving lives. No action is too small. Every time you mask up, stay home when you are sick, limit a gathering, you are making a difference. And we just need you to hold on a little bit longer because hope is on the way. As we previously mentioned, and as you may be seeing in national news, there are 2 vaccines on the precipice of FDA approval, Pfizer and Moderna. Our federal partners tell us that pending approval, Oregon will be receiving 35,000 doses of the Pfizer vaccine shipping December 15th. And the following week, approximately 71,000 doses of the Moderna vaccine will also be on their way. So certainly there's some light at the end of the tunnel. It's remarkable that scientific strides have enabled us to have a vaccine just mere months into this historic pandemic. Rigorous clinical trials have not only worked to ensure the vaccines are safe, but that they are safe for our vulnerable and diverse communities. And through our Western State Scientific Safety Review Work Group, some of the foremost doctors, scientists, and immunologists in the West will be reviewing and confirming each FDA approval. In line with CDC guidance, we will also be prioritizing front-line healthcare workers and long-term care residents and employees as the first group to receive the vaccine. This includes our doctors, nurses, janitorial staff, and others who have the potential for direct or indirect contact with COVID-19 patients or infectious materials. Director Allen and Director Banks will go into more details, but we anticipate that all Oregonians in these settings will have the opportunity to be vaccinated by the end of January. As the vaccine becomes more available, we will be exploring how we can use the vaccine as a potential tool to get our kids back into the classrooms as quickly as possible, how we can protect Oregonians in high-risk jobs, and how we can prioritize communities disproportionately bearing the brunt of the pandemic and past and current health inequities. And when it's my turn to receive the vaccine, once approved by the FDA, I will certainly be ready to take it. The introduction of a vaccine, however, doesn't end this pandemic. Right now and into the foreseeable future, the only way to reduce transmission and slow the spread is to take safety precautions until the vaccine is both widely available and widely administered. And this is going to take time. I will end with saying that I know these are the vaccines we have all been waiting for. And as we work across Oregon and the entire country to get them widely distributed, I am asking you all to buckle down for just a little bit longer. We can finally see a light at the end of this tunnel, but we are certainly not there yet, and we have to keep at it. With that, I'm going to turn it over to Director Allen.
Thank you, Governor Brown. Again, I'm Patrick Allen, Director of the Oregon Health Authority. I want to start off today by sharing another couple of grim milestones and some further detail to the numbers that the governor shared. Today, we'll break the 80,000 mark for the total number of new COVID-19 cases in Oregon, with today's count of 2,176 cases, a new daily record. We also have surpassed 1,000 total coronavirus deaths since the start of the pandemic, for a total of 1,003 deaths, with today's count of 30 deaths, another daily record. Our daily case counts continue to stay well above 1,000. Seeing only triple-digit numbers has become something of a rare occurrence. The last time we were below 1,000 cases was November 27th. Before that, November 17th. Our hearts go out to the loved ones of each of these individuals. Every death represents an empty seat at a holiday dinner, a warm hug that's missed, a winter morning walk that cannot happen, and we mourn every one of them. The surge in Oregon, as is the case around the country, continues unabated, and it's only expected to get worse. As the case tallies from Thanksgiving weekend come in and we continue into the holiday season, the toughest times in this crisis for our state lie ahead. But I also have some good news to share today. Next week, on December 10th, the Vaccines and Related Biological Products Committee, or VRBPAC, which advises the Food and Drug Administration on its consideration of emergency use authorizations for new drugs, will meet to consider and is widely expected to recommend approval of the first of 2 COVID-19 vaccine candidates submitted for emergency use authorization. The first vaccine, developed by Pfizer and BioNTech, was found to be 95% effective in preventing COVID-19 among phase 3 clinical trial participants. If all goes as expected, the first shipment of the vaccine, 35,100 first doses, will be shipped to Oregon on December 15th. A second shipment of 40,950 Pfizer first doses is expected to be sent to Oregon on December 22nd. The second vaccine, made by Moderna, was found to be 94.5% effective in its phase 3 clinical study and is set for consideration by VRBPAC on December 17th. If the vaccine is ultimately approved, we expect to see 71,900 first doses shipped to Oregon on December 22nd. What this means is we anticipate a total of 147,000 first doses of the Pfizer and Moderna vaccines in Oregon in December. We also expect an additional 87,750 doses of the Pfizer vaccine and an additional 31,700 doses of the Moderna vaccine on December 29th to begin providing second doses to patients who received the first dose of the vaccines earlier in the month. While these numbers are preliminary and subject to change as the CDC provides states with more detailed information in the coming weeks, this is no doubt terrific news. I want to emphasize that OHA will be fully transparent about the shipment of vaccines we receive. We'll keep Oregonians informed every step of the way as our federal partners and manufacturers distribute the vaccine nationwide. OHA, in concert with Governor Brown's office, have been working with local public health authorities, providers and health systems, community-based organizations, and other critical partners around Oregon to implement our state's vaccine distribution plan. This has included enrolling vaccine provider sites in the COVID-19 vaccination program so we can begin allocating doses of the vaccines to those locations within days after they arrive in the state. Hospitals will be the primary sites for immunization of the first group of vaccine recipients, the 1A group. That will include healthcare workers, first responders, workers in long-term care facilities and congregate care settings, and long-term care facility residents. Guidelines for prioritizing ensuing phase 1 groups, such as essential workers, adults with high-risk medical conditions, and adults 65 and older, are still under development. It's also included setting up a statewide cold chain network of locations that can provide ultra-cold storage for the Pfizer vaccine, which has to be stored at negative 70 degrees Celsius, which is about 94 degrees below 0 Fahrenheit. And it's included a significant effort by the health authority's community engagement team to galvanize partnerships with community organizations that reach and support underserved populations. It's critical we invite these partners to share in the decision-making process and help us communicate to Oregonians about the vaccine when it becomes available. If we're able to successfully immunize every Oregonian in the state against COVID-19, we need to do this work. We'll bring together community leaders to help us make these critical prioritization decisions. We'll convene community voices in December, listen to their input, and share their prioritization recommendations before we expect the vaccine to be available for essential workers. While the impending vaccines are a light at the end of the tunnel, getting through that tunnel in the next several months will be the toughest we've seen. We cannot sit back, put our hands in our pockets, and just wait for the vaccine to come to us. For most of us, getting vaccinated is several months away. And until you get vaccinated, you are at risk of getting COVID-19, spreading it to others, and keeping this pandemic going. We all know what needs to be done to get us through this home stretch to when we can get the vaccine. Stay at least 6 feet apart from people outside your household. Don't attend or hold large gatherings. Wear a face covering inside and outside. Don't travel. Wash your hands frequently. Stay home if you're sick. Thank you. Now let me turn it over to Rachel Banks, our Public Health Director, who will talk about vaccine safety and efficacy and provide an update on our latest COVID-19 forecast and the outlook for the coming weeks.
Thank you, Governor Brown and Director Allen. Hello, Oregonians. I'm Rachel Banks. I use the pronouns she, her, and hers, and I'm the Public Health Director for Oregon Health Authority. As Director Allen stated, the notion of a COVID-19 vaccine finally arriving in Oregon before the end of the year is absolutely exciting. I'm so proud of the work of the Oregon Health Authority staff, local public health authorities, our state's providers and health systems, our tribal communities, and community-based organizations for all of the work that they've done and continue to do to help our state step up a robust, comprehensive, and equity-focused vaccine distribution plan. We have been preparing for this moment for months, and we will be ready when these vaccines arrive. The 2 vaccines tentatively scheduled for delivery to Oregon over the next several weeks are reported not only to be safe and effective, but highly safe and effective. And we know these reviews of these vaccines are ongoing, but preliminary results from phase 3 clinical trials have found that, as Director Allen pointed out, both the Pfizer and the Moderna vaccines are about 95% effective against COVID-19. That is almost unheard of. And I must admit, when we first as a nation started talking about vaccine development, I did not think we'd be looking at a 95% effective rate. By comparison, on average, according to recent studies reported by the CDC, flu vaccination, which reduces the risk of flu illness between 40 and 60%, in other words, is 40 to 60% effective among the overall population, and that's even when seasons are most circulating flu viruses are well matched to the flu vaccine. And everyone knows that with the flu vaccine, public health is pushing that vaccination like crazy every year because 40 to 60% effectiveness is pretty good. We've also learned from preliminary phase 3 trial results that Moderna's coronavirus vaccine is 100% effective against severe COVID-19. And that means that among the small population of folks, about 5% of the trial participants who received the vaccine but were still infected with COVID-19, none of their illnesses, 0, not 1, progressed to severe disease that could cause them to be hospitalized or die. The Pfizer and the Moderna COVID-19 vaccines are also reported to be safe. And while we know that all vaccines may cause some side effects for people, in this case, about 1 in 10 people who take the COVID-19 vaccines may experience some mild side effects. And these common side effects include pain, swelling, or redness where the shot was given, mild fever, chills, feeling tired, headache, and muscle joints and aches. These symptoms are not believed to cause any long-term issues and are only temporary, and they really indicate that your body is putting up an immune response, a fight, that's going to help you prevent illness if you're exposed to the virus in the future. But while the vaccine is coming and it's so hopeful, it's not here yet. So I'm going to take you through a look at the pandemic challenge facing Oregon in the next couple of weeks. According to our latest forecast, the virus will most likely spreading at a transmission rate of 1.25 on November 19th. That was the day after Governor Brown issued the freeze order, which put additional protections in place across the state. A transmission rate of 1.25 means that right now, each person who's infected with COVID-19 is spreading it to more than one other person besides themselves. So that means the virus is expanding at an exponential rate and is spreading wider and faster. So that means more cases, more hospitalizations, and tragically more deaths in the coming weeks. To put that estimated case increase in numerical terms, if the transmission rate for the virus were to be maintained at where it was estimated November 19th, once again at 1.25, we would continue to see an exponential increase in new diagnosed cases. For example, for the 2-week period between December 11th and December 24th, the projected number of new diagnosed cases would reach 660 per 100,000 people. That rate translates to a daily average of over 2,000 diagnosed cases each day. New severe cases would increase to 75 per day by December 4th, Christmas Eve. What if transmission rates jumped after people started gathering for Thanksgiving? If we were to see an increased transmission around Thanksgiving to the same level as we saw in late October, that was a transmission rate of 1.5, and that transmission rate was maintained, we would see that new diagnosed cases would increase to 920 per 100,000 people, once again for the 2-week period between December 11th and December 24th. That's an average of 2,700 new diagnosed cases per day, which is more than twice what we were seeing on a daily basis. And new severe cases would increase to 110 per day by December 24th. Our hospital situation remains precarious, so we must stay vigilant. This forecast tells us we remain on pace to overtop our hospital bed capacity unless we turn things around soon. Our hospitals have been making changes to scale back elective procedures, as Director Allen talked about, but they only have finite options. OHA is reporting hospital capacity on a daily basis. We're meeting with our hospital partners and keeping a close eye on the situation in every region across the state. It's too soon to say how the Thanksgiving holiday affected our transmission rates. And you may be wondering, did the protections that Governor Brown put in place through the freeze offset an increase in cases due to holiday gatherings? Or did the holiday add more fuel to the surge that's happening across the country as people spend more time indoors together? It's too soon to definitively say. However, we continue to see evidence that the majority of Oregonians are taking responsible steps in their lives and doing their part to slow the spread of COVID-19. And I want to thank you. According to our latest social distancing estimates and mobility reports, Oregonians are wearing masks, they're staying home, and they're traveling less. For example, retail, restaurant, and indoor recreation activities are down 20% from the pre-pandemic baseline. Movement at bus stops and other public transportation stations are down 35%. People are going to offices and other workplaces less, and we see that that's down 40% from the pre-pandemic numbers. In contrast, more people are staying home. That's up 12%. Visits to the grocery store and pharmacy are up 5%, and trips to parks are up 11%, as people focus their shopping on the essentials and choose to play outside, which is a fun, safer option. In addition, our air travel remains at approximately a third of the normal volume, and mask use remains well over 70%. We see those reductions in counties across all parts of Oregon. However, we don't see the same levels of reduced interactions everywhere. Our data are consistent with our survey findings from early this fall, which told us that most Oregonians are listening to public health prevention guidance and following the governor's pandemic protection orders. Once again, thank you. Thank you to every Oregonian who's changed the way you work, the way you see your family and friends, and the way you spend your free time to prevent the COVID-19 virus from spreading faster. And to everyone who's lost a job or a home due to the economic fallout caused by COVID-19, I want to say I recognize the hardship that you're experiencing. We see you, and we are committed, and I'm committed to do everything possible to eliminate the hold that COVID-19 has on our community, so that Oregonians can feel safe and confident in fully restarting our economy. The promise of a safe and effective vaccine arriving in Oregon should give us all hope, but it's too soon to drop our guard. Our national data tell us that small concentrations of people gathering inside have led to super spreader events, which have fueled the surge that we see across the US and in Oregon. And that's in line with our case investigations, which have frequently traced outbreaks to indoor social gatherings where people weren't wearing masks. Throughout the nearly 10 months we've endured this pandemic, Oregonians have, by and large, done their part and contained COVID-19 better than people in most other states. And we need to hold on for a few months longer while we work to distribute the safe and effective vaccines that are on the way. And finally, it's important to remember, it's not the vaccines that are the solution, it's us getting vaccinated. That's the safest, most effective, and most reliable way to keep yourself and the people around you from getting sick with COVID-19. And I'll leave you with this pledge and this challenge. I don't know exactly where my turn is to get the vaccine, where my job might fall on the vaccine priority list, but I can tell you that when my time comes to get the vaccine, I'm getting vaccinated as soon as I can. And I'm going to turn it back to Director Allen and Governor Brown with this question. Will you get a COVID vaccine when it's your turn?
Thanks, Director Banks. The answer is absolutely. Director Allen, you?
Absolutely, Governor. I'll get vaccinated when it's available.
All right. With that, Charles, we're ready for questions. And thanks to our Director of the Oregon Health Authority, Pat Allen, and Director of Public Health, Rachel Banks, for joining us today. And we also have Dr. Dean Seidlinger, our state epidemiologist, as well.
Thank you, Governor. For the reporters on the line, please use the raise your hand function under the participants tab to ask a question. Please also list your first and last name and, if possible, your media outlet. We'll start first with Gary Warner from EO Media. Go ahead, Gary.
Thank you, Governor, and other folks. with these numbers that you're putting out as the possible projections, they're pretty scary. You didn't mention deaths, but you can kind of extrapolate it from these numbers. Why not, since we're so close to the vaccine, take more radical action to shut things down, to get this curve down, than just what's being done right now?
Thank you, Gary, for the question. And look, we have 25 counties now across the state that are in extreme risk. This is basically shutdown mode. Without further federal assistance, it will decimate our economy even further. And frankly, it's just not sustainable if we move to a complete shutdown mode without federal assistance. So what we know is this: we know that with the new metrics in place, with Oregonians in full compliance, we can reduce transmission and slow the spread of the virus.
I'll let the others go.
Thank you, Gary. We'll go next to Lachey Wesley with K2.
Hi.
Go ahead, Lachey.
I had a couple questions about the vaccine. Has the state identified just how many frontline healthcare workers and long-term residents there are in the state? Are you confident that every single person will be in those groups will be able to get the vaccine? And what regions and what hospitals will receive those first doses?
So Shay, here's what we do know. We have roughly 300,000 healthcare workers. As Director Allen mentioned, that's a pretty broad definition. It includes anyone who's working, for example, in a hospital that could be exposed to COVID-19. And we have roughly 60 to 70,000 residents of long-term care facilities and staff. So over time, can we get all of them vaccinated? Yes, but it will not happen in this first delivery of the vaccine because, as we said, we're getting roughly 100,000 vaccines in this first delivery. Director Allen, do you want to respond to her second question?
Yeah, let me add a little bit to the first question as well. It'll take about 700,000 doses of either of the vaccines, since they both require two doses, assuming all of the people who are eligible in that first category take the vaccine. What we don't know today is we don't know how quickly the manufacturers are going to be able to supply us an ongoing supply beyond the initial doses. Just this week, Pfizer announced that it was not going to be able to produce as much initially as it thought based on some supply chain concerns. So I think that's a question yet to be answered in terms of how long it'll take. In terms of the second question about the hospitals, we'll be later today posting a very detailed PowerPoint that's got several pieces of information, including a map of where vaccine will be distributed to.
If there are not enough vaccine doses to meet those groups, how will you prioritize those groups?
Yeah, so in the healthcare worker category, what we're going to be doing is prioritizing the stability and availability of the healthcare system. So frontline hospital workers who come in patient contact to preserve capacity of hospital beds. Right now, we're having some challenges being able to staff beds that would otherwise be available with healthcare workers that are on quarantine or isolation or otherwise aren't able to report for work, and being able to vaccinate those workers first will be the priority to be able to get that done. Beyond that prioritization, the advisory group that we're assembling will be a key element in how we prioritize all the other subgroups and categories going forward.
Thank you.
Thanks, Lachey. We'll go next to Lisa Balick with COIN. Go ahead, Lisa.
Yes, good morning. Question for Pat or Rachel. People are already calling their doctor's offices. Now they really will be trying to get on a list. How do you get in line for the vaccine? Obviously, in other words, it's not going to be this week or next week or this month for most people, but how do people get in line for this?
Director Allen, Director Banks, does one of you want to take that one?
I'm looking at Rachel, and she's probably looking at me. I guess I would say that I wouldn't think of it in terms of a line. I don't think there's a line you can get in today, and that your call will be taken in the order it was received, kind of thing. It's gonna if people are not in some of the high priority categories that we've talked about, essential workers, people with serious health conditions, healthcare workers, those kinds of things. It's going to be a while before the vaccine is available to regular Oregonians. And so I think what I would do is I would keep your ears open, and we'll provide information on our website about what category we're currently distributing vaccine to. And you know, sort of think of it as kind of like the reverse of a funnel, where at first it'll be a fairly narrow amount of vaccine that's available, but as time goes by, and particularly if yet more vaccines get approved, that volume should widen out. And by the time we're out of prioritized groups, it should look a lot more like other vaccines that you get that are pretty straightforward.
And
But is it
Lisa,
likely going to be distributed?
Go
Is
ahead.
it likely going to be distributed through the hospitals or through private providers?
It'll initially be through hospitals because that's where we want to focus the delivery, but it'll actually be delivered through a variety of channels. The federal government has relationships with a variety of pharmacies, and we'll be enrolling providers beyond the hospital system right away to be able to, again, make it look like really any other kind of a vaccine that gets distributed.
But
I would
Lisa,
add that by the time we get to the broader phases that it will be distributed, we'll be working in partnership with local public health authorities. It'll be distributed through tribal clinics, and it will be distributed in a variety of ways, what we call open pods, community clinics. So there will be multiple ways for folks to get vaccinated once we have that vaccination for the general public.
Lisa, I just want to close. While there is some light at the end of the tunnel, it may be several months that we get everyone vaccinated, and it's going to take time. So I want to encourage and plead with Oregonians to continue to comply with safety protocols in place. Continue to wash your hands, watch your distance, wear your mask. If you are sick, please do not go to work. Please do not go out into public. And of course, if you haven't gotten your flu shot yet, please get it.
Thank you, Lisa. We'll go next to Andrew Thien with the Oregonian. Go ahead, Andrew.
Thank you. Based on the projections in this modeling, what would active hospitalizations and active ICU capacity be by Christmas Eve? I mean, we're at what, 550 now? I'm curious what we'd be under this modeling.
Dr. Seidlinger, would you like to respond to that question, please?
Sure. Thank you, Governor Brown, and thank you, Andrew. I think the exact kind of hospital capacity is difficult to answer. These projections indicate the average number of daily admissions to hospitals, and their length of stay can vary, but we know they don't come in one day and go home the next day. So that will put some significant constraints on our hospitals. The baseline in terms of staff beds available is also changing. Right now, hospitals are canceling elective procedures to free up staff to work in inpatient settings. And as staff members go out and sick with COVID-19 or exposed to COVID-19 and need to stay home, that can reduce bed capacity. So all those variables come into play. But we watch this number, and we do anticipate that with these increases in cases, if we as Oregonians don't step up our game to reduce transmission and reduce cases, those cases potentially by the end of the month, if not into the beginning of the year, will overtop our capacity. So we need everyone to help protect themselves, protect their families, limit your gatherings, wear your masks, and keep your distance. Most of you are already doing that, and again, we thank you for that. For those who aren't, we want you to reconsider those activities, because by doing that, you're not just protecting yourself and your family, you're protecting all those around you from the potential need to be hospitalized with COVID-19. You're making sure that those beds are available if you get COVID-19, if you have a heart attack, if you're in a motor vehicle accident and need a bed, that's going to be available. So we all benefit from making these sacrifices so that we don't run into a situation right around the holidays when our hospital capacity is extremely constrained and hospital providers are forced to ration care or decide who gets the ICU bed that they have available. That's not a situation any Oregonian should be placed in or any provider should be placed in.
Just a quick follow-up, Dr. Seidlinger. Does that, I mean, we're at 550 now, given the rate of 100 cases, potentially severe cases, or 110 severe cases. Does that look like 800, 900, more than 1,000 active hospitalizations?
I think it gets very hard to predict the future. So we use these estimates and these models to really help us plan. And so what this lays out is that we still need to do work to try and create capacity and maintain capacity in our hospitals. We know that hospital length of stay can vary. We know that individuals who are hospitalized now have a very different experience than they did early in the pandemic, when a big percentage of our folks in the hospital didn't just require being in the hospital, but required intensive care unit support and often ventilation. So we're seeing changes in the care that people get in the hospitals, and that impacts the type of staff, the type of staffed bed that hospitals have to have, and the length of stay people are in there. So as we put all those together, it really is more of a kind of estimate that towards the end of this year, we really could be in a place where those daily admissions on top of the hospitalization, that people who are already in the hospital could really overtop the capacity for our healthcare providers to deliver the quality care that we all expect and that we all deserve.
Given that we saw 2,100 cases today, does that indicate we're closer to the more dire scenario in the modeling or the rosier one?
I think it's very hard to say. As you heard earlier, there are a lot of variables in play right now, even more so than we typically have. We did see impacts from the freeze that Governor Brown implemented in terms of people seeming to cut down on their activity and limit their contact with others. That does reduce transmission, and that's what we need everyone to continue doing. But we also know that while Oregonians stated in a survey that they were much more likely to spend Thanksgiving with just members of their own household than many other states, that desire and urge to get together with friends and family was great for a lot of people. So we did see some gatherings. Hopefully people took precautions, wore masks, and kept their distance. But we know that with our loved ones, we often let down our guard. And so we'll be monitoring over the next week and week and a half to see if there's an increase in transmission based on Thanksgiving get-togethers and the activities in the weekend after, when people were spending time with loved ones. If that transmission increased significantly, that could offset some of the benefits we really were seeing from the governor's freeze. Right now, as you heard, 25 counties are in extreme risk and have the most limitations on get-togethers outside the home and the business activities, the sectors that people can participate in. That is really designed to reduce transmission across those communities to get a handle on this number so that we don't get into a place where we're in that worst case scenario. But certainly we will know more about that, which of those trajectories we're on in the next week as the numbers continue to come in. And the record high number today, we hope is not a pattern, but we've seen time and time again through the month of November that we've broken records that we never thought were possible to break here in Oregon. And today, with the case count and the high numbers of deaths, it's a tragic reminder of the incredible impact this has had on Oregonians. We know the measures we're taking to fight it have tremendous impacts as well. And we need to all work together, all continue to do the activities we have so we can get through this dark winter and spring together and come out vaccinated in a much different world in the summer.
Thank you.
Thanks, Andrew. We have quite a few people in the queue to ask a question. We'll try to get to as many as we can. We'll go next to Pat Duras with KGW. Go ahead, Pat.
Good morning. So, three-part question. One, have you seen a bump yet from Thanksgiving? It's my understanding that a lot of people will show symptoms within 5 days. Second, is there any cost for people when they get this vaccine? And third, is there enough cold storage in Oregon, especially in the rural parts? Thank you.
Thanks, Pat. I'm going to turn that over to Director Allen and Dr. Seidlinger.
Yeah, thanks for the questions. In terms of cold storage, we're working. We have adequate cold storage for the initial shipments we're receiving. We're acquiring more portable cold storage. But remember that only the Pfizer vaccine requires the ultra cold storage. The Moderna vaccine and other candidates that are out there require more standard refrigeration typical to vaccines. And so part of what we're going to be able to do in this process is steer vaccine to different parts of the state based on what those cold chain requirements are to be able to manage that. And I'm sorry, Pat, I've lost the front end of your question.
That's all right.
I
Just
can take the
following
next
up
two
on,
if you want.
okay, yeah, Thanksgiving. Have you seen a bump yet?
So let me continue with the vaccine first. You had a question about cost of the vaccine. Right now, the federal government has purchased the vaccine and the accompanying supplies to deliver the vaccine, like syringes and other things. So those will be forward deployed here into Oregon as they will to other states. And there will not be a cost to individuals to get that vaccine, whether that's delivered in a long-term care facility from your employer to you as a healthcare worker, or once we start giving it to the broader public, it will be delivered to folks without a cost. As for a Thanksgiving bump, you're right that some initial folks who were potentially exposed to the virus could be starting to show symptoms and test positive now. We don't have an indication yet of seeing an increased number of cases specifically tied to Thanksgiving. What will happen over the next week and a half is that as people develop symptoms or people are contacted by someone who may have had COVID and come in for testing, those test results will come back. And when they come to public health as part of our investigation, we'll be trying to identify where their potential contacts were before they got sick and when they potentially had symptoms. So that's where I think over the next week, we will see what the numbers show, see what our public health investigations are showing as we investigate. But right now, we do not have a specific tie to this record number of cases to Thanksgiving. What we do know is that testing did decline over the holidays as people didn't seek testing as much. And so that testing volume has definitely come up this week, and that could be some reflection in the number of cases that we're seeing.
Thanks, Pat. We'll go next to Sarah Klein with the Associated Press. Go ahead, Sarah.
Hi, yes, shifting slightly. Governor, I'm interested, as these cases are surging across the state, there have been lawmakers and residents advocating for a special session, and I'm just curious where you stand on that and if we can expect that to happen in December.
I'm absolutely committed to meeting the healthcare needs of Oregonians, making sure that our Oregon families have the tools and resources they need to stay in their homes, their rental apartments, and making sure that our businesses have the resources they need to survive. I am working with Republicans and Democrats and look forward to coming up with a solution that will address these needs and that can be addressed in a special session sometime in the next several weeks.
So just to put it bluntly, should we expect you to call for a special session within the next week or two?
Look, I'm meeting with lawmakers and in fact have a meeting today. I anticipate I want to see support, frankly, from Democrats and Republicans for the work that needs to be done. And hopefully we'll know in the next few days.
Thank you.
Thank you, Sarah. We'll go next to Brenna Kelly with KPTV. Go ahead, Brenna.
Good morning. I believe these questions can be for Director Allen. Will the state make a recommendation about the best vaccine to take, or do you believe all four are created equally in terms of who can receive them? Is it different for people with underlying conditions, et cetera? And the next question is, does the news about Pfizer's supply chain problems change the number of doses Oregon is expected to receive? And does that news cause concern about future promises for doses made by different vaccine makers?
Yeah, so to the first part of the question, based on what we know today, I would not expect that we would make recommendations about particular vaccines. I don't think we know enough about the other candidates out there to know if there are particular indications that would apply to them. I would expect that FDA would provide guidance on that. In terms of the production issues, what we've been given to understand by Health and Human Services is that the disruption announced by Pfizer does not impact the initial allocations that we've been told to expect. But I guess it's only fair at this point in the pandemic to point out that pretty much every single number of things we've been told to expect, whether it's PPE or tests or anything else, has ultimately very, very frequently not been an accurate number. I think they've often been more aspirational. And so I guess I would consider the numbers that we're receiving right now about vaccines to also potentially be aspirational. I hope that's not the case, and I hope the numbers get bigger over time. But I think we should be prepared for the fact that, especially initially in the manufacturing process, there may be some underperformance.
Thank you.
Thanks, Brenna. We have time for just a few more questions, so we're going to go next to Aaron Ross with OPB. Go ahead, Aaron.
Hi there. I wanted to ask how you plan to ensure that vaccines are distributed equitably when you're prioritizing. Like, how are you going to be prioritizing distribution across different racial groups and populations within Oregon to ensure that groups that are, or communities that are being particularly hard hit are have their needs met?
From my perspective, we certainly will have only a limited amount of vaccines at the outset, and we're looking at how we can use these vaccines strategically, who is most at risk, how can we reduce outbreaks. Obviously, our goal in this first tranche is to make sure that we're protecting our frontline healthcare workers, those who are caring for our COVID patients day and night, those who are providing incredibly essential medical care to Oregonians across the state, and of course, our vulnerable elders and those who provide for their care. With more detailed information, I'm going to turn that over to Director Rachel Banks.
Thank you. I appreciate that question. We're going to do several things to ensure equitable distribution. One is assembling an advisory committee with the specific charge of looking at how we can use this vaccine to help us reach our goal in Oregon Health Authority to ultimately eliminate health inequities in 10 years. We see this as a perfect opportunity to do that for a number of reasons, partially because COVID-19 has disproportionately impacted many communities of color and tribal communities. We see our vaccine distribution as a way to rectify some of that. We will also be having a broad definition of healthcare workers, for example, so that includes people who are taking care of our community members with intellectual and developmental disabilities, as well as being in partnerships with our tribal communities. So once again, we have a variety of ways to ensure there's equitable distribution, both geographically and particularly focused on our communities of color who've seen unfair disproportionate impact from COVID-19.
Thank you.
Thanks, Aaron. We'll go next to Nick Budnick with the Portland Tribune. Go ahead, Nick.
All right, thank you very much for the opportunity. I am curious, the vaccines are expected to affect the severity of the disease for the people that receive the vaccines, but it's unknown, as far as I can tell, how they will affect actual transmission of the virus. Have any of the health officials there taken a look at this issue, and do they have any preliminary thoughts on what that effect might be?
Nick, I'm going to turn that question over to our state epidemiologist, Dr. Dean Seidlinger.
Thank you, Governor, and thank you, Nick. I think, what we've seen is very promising results from the trials that happened, and those phase 3 trials enrolled tens of thousands of individuals. And so what we've learned from those trials, particularly for these first 2 vaccines that are made with very similar technology, is that they seem to have prevented disease in the individuals who received the vaccine versus those who received placebo, and seem to have prevented, even more importantly, the severe disease, the necessity for hospitalization. So that initial data has really shown a decrease in the ability to obtain the disease, which we think would also coincide with the ability to transmit the disease. But we'll continue to receive data from these initial trials from AstraZeneca and the other partners who are developing vaccines. And this vaccine, like every other vaccine that's approved for use in the United States, will continue to be monitored once it's released. So for those individuals who receive the vaccine, how likely are they to come down with the virus later? Are there folks around them that, for potential transmission? Side effects and severe side effects will be monitored. So this vaccine these 2 vaccines really do, in the preliminary data that look very promising, prevent disease and prevent severe disease. And so we have no indication that they're not preventing transmission as well, but we'll continue to monitor that. And I think until then, we're in this together with the measures we've been taking and the sacrifices we're making until we all have that vaccine in our arm with the protection that it offers.
Thank you.
Thanks, Nick. We have time for just one more question, so we're going to go to Rick Linforce with KVAL. Go ahead, Rick.
Thank you for taking my call. Regarding the phased rollout of the vaccine, point of clarity seeking, hospitals and healthcare workers are mentioned in the phase 1 area for initial distribution. Where does emergency medical services such as fire, police, volunteer search and rescue, and other providers fall into that? Is that in phase 1 or is that part of phase 2 rollout?
Director Allen, do you want to pick that one up?
Yeah, sure. And just to be clear, phase 1 actually is divided into 3 sub-phases. So phase 1A, 1B, and 1C before we move on to phase 2. Phase 1A, my understanding is includes first responders as a part of the definition of healthcare workers.
Thank you, Rick. That's all the time we have for questions today, everyone. Thank you.
Thank you, everyone. Please stay safe out there.